Today we're going to talk about how to fix your low back pain from sitting at your desk. And we're going to break this video down into a couple of different parts. We're going to talk about anatomically, like what actually happens to your low back, what happens to your spine from sitting, and why that leads to kind of some pain and some irritation of those tissues. And then we're also going to talk about some of the functional changes that happen to our body, some of the muscle imbalances that start to happen as we sit for long periods of time, and how to break them up. Guys, this is exciting. We're going to talk about some foam rolling, some stretching, some exercises. We're going to cover lots of stuff in this video, so let's just get into it. So in our spine, we have vertebrae, and in between those vertebrae, we have discs. And when our body sits, we load that disc a little bit more than when we do standing. I'm going to use this ball to demonstrate something for you. So if we have the discs in between our low back, this ball being your disc, the middle part of it is like a gel. I think of like a jelly donut sort of thing. So if we are sitting, we're compressing that disc a little bit. And then what normally happens is we don't just sit like perfectly like a robot. Well, actually, most people kind of forward flex a little bit. So like if you're sitting in a big cushy chair, like a big cushy couch, you kind of notice that you kind of forward flex a little bit in that low back. That's similar to what's happening when you sit in a chair. And what that does to the disc is it kind of pushes some of that gel to the rear a little bit. And it just loads up the back side of the spine and puts some pressure on those structures there. Not a big deal. You know, our body's meant to be used and it's meant to be moving around and bending, twisting, doing all kinds of different things. The problem happens is when it happens excessively, when we're doing that for a long period of time, like when we sit all day long at our workspace and don't take breaks. So what do we do about it is we take micro breaks, and those are exactly what they sound like. They're just small breaks that you can take throughout the workday, every 30 minutes or so, just to break up that monotony of sitting. Here are a couple of micro breaks that I like right now that undo some of those kind of changes and some of the forces that apply to your disc. Try them out right now. This is called the air ladder. So we're just standing up really nice and tall and reaching up really, really high and then climbing that pretend ladder. This does a great job of mobilizing the spine kind of side to side and just helps get things moving, kind of take some tension off of it. We're also getting a little bit of extension as well. The next we're going to do is we're going to do some side glides. That is not me taking out my frustration on this poor spine. It's me trying to demonstrate that we're trying to move side to side like this. So one hand on the ribs, the other hand a little bit lower on the pelvis, and we're just kind of going side to side, trying to get that kind of lateral movement into the spine. Here's me doing the other side. You just switch the hands, piece of cake. And then if we want maybe a little bit more out of this, we're having a hard time, you can also use the wall. So you just kind of put your elbow on the wall there and you let those hips kind of dive into the wall there with a little bit of overpressure from your hand. All right, guys, functionally what happens from our body from sitting or maintaining a position for a long period of time is sometimes we can start to develop unfavorable muscle imbalances. A common group of muscle imbalances that happens to people when they sit is referred to as lower cross syndrome. Now, lower cross syndrome is basically a group of muscle imbalances around the low back and the pelvis. And what'll happen is if you kind of look at this, it makes a little bit of an X. Certain muscles like your hip extensors and your anterior core, they start to get kind of weak or inhibited, and then you start to get the other part of the X, and they start to become really, really tight and stiff, like your hip flexors and your low back musculature. So what I like to do to kind of change things around a little bit and reset these kind of adaptations that happen, these unfavorable adaptations, is I like to start implementing some sort of myofascial release, some sort of foam rolling, lacrosse ball work, and then doing different stretches or exercises that specifically cover those unfavorable changes with lower cross syndrome. So we're gonna go over some of those right now, guys, and you can also add these to your micro breaks if you like them and get a big benefit from it. Check these guys out. We're going to start with foam rolling the mid-back here. So I'm going to give myself a big hug that pulls those shoulder blades out of the way, and I'm just going to roll back and forth on the mid-back here. I can also shift my weight over to the side, and that allows me to get into those rib angles a little bit more, kind of mobilize those ribs and just open things up a little bit more. Also, one of my favorite things to do is kind of park my hips on the ground and use that foam roller as a fulcrum. So now I'm just extending over the top of the foam roller, and that just allows me to kind of get in there, get a little bit more T-spine extension. I can also flip around and do what's called the foam roller prayer, where I'm just going to rock back on my heels, and I'm going to practice driving my sternum down to the ground. And I personally like to time this one up with my breath. So I'll go breath in, and when I exhale, I'll drop my sternum down. Next, we're going to work on foam rolling the hips. So I'm just kind of laying on my side, letting that foam roller get into my left hip there. And as I progress, I can start to sit up a little bit, and I can even cross my left foot onto my right knee, and that opens up that hip so I can get in there a little bit more. Foam rolling the low back can be a little bit tricky. So what I'm doing here is I'm holding the hamstrings, and that allows me to maintain my torso so it's a little bit more upright, so I'm not just overextended over the top of that foam roller. And I can just go side to side into my low back here. Now we're going to move on to stretching. This is a hip flexor stretch, so I'm trying to stretch out my left hip flexor there. What I'm doing is my knees are just kind of on the ground and I'm rocking my hips forward. I'm not doing that. I'm not overextending the low back there. I'm just rocking my hips forward here, nice and easy. Next, we can do a quad stretch that a lot of people have done. I know people used to do this all the time, just kind of not really even thinking about it. But this actually gets a different hip flexor called your rectus femoris, and I can use a chair there for balance if I need to. I'm just kind of bringing that guy back there. I'm not forcing myself into any uncomfortable positions. All right, guys, this is the dead bug. So we're keeping our core nice and stable, and we're just moving one limb off of that without breaking that stable core. So I'm just kind of doing toe taps. I did my arms before, and now we can go to opposite arm, opposite leg, and this is where it starts getting progressed here. It's tougher than it looks, so make sure you try this one out. I'm really making sure that I'm not kind of overextending in the low back. So you'll see here in a second, I start to kind of break here right in this spot. And you see how I kind of lose my core, I lose that position, and I'm overextending, my ribs are flaring to the ceiling. We don't want to do that. Next, we have the glute bridge. I'm going to start with 2 legs on the ground. I'm just going to lift my hips up, making sure that I have a nice straight line from my knees to my hips to my shoulders up the way at the top. When that's easy, you can do like a march. So I'm kind of going up on 2 legs, and I'll switch to lift 1 leg. This challenges that core a little bit more. Just going back and forth, making sure when I lift that leg up that pelvis isn't dropping or becoming unlevel. Next, if that's pretty easy, you can go to a single leg one where I keep 1 leg out and I'm just keeping my thighs parallel, lifting my hips up, back and forth here. So guys, I hope you can implement this. I'm going to kind of write it all out right here and summarize it, take a screenshot of it, keep it at your desk, do whatever you need to. And I hope this helps you guys out. If you have any questions, be sure to let me know in the comments below and be sure to subscribe to the channel. See you guys next time.